Today I'll be introducing to you my world-renowned orthopedic surgeon, Dr. Debiparshad at Lemplastic Institute here in Las Vegas. I'm so grateful and confident to be under his care. Today he'll explain to you my procedure of tibia limb lengthening and all that's involved in it.
Good. Okay. This is Dr. Debiparshad at the Lemplastic Institute here in Las Vegas, Nevada, and we're hanging out here with Luke. She came with me. She came for her first consultation today in regards to doing either tibia or femur lengthening. We were reviewing a couple of her X-rays, and her goal is obviously to try to get as much length as she can get. So ideally, 3 inches or 3 inches plus. I think it's going to be a little challenging with tibial lengthening. A couple of reasons. It's generally challenging to get that much length in the tibia in most patients anyways, particularly with her. She's got a shorter stature. In addition, her actual bone sizes are smaller, so we'd be able to maybe get in a nail that could even do 8 centimeters of stroke length. But because of those reasons, femur lengthening might be a better option for her. I've gone over a couple X-rays of what both surgeries essentially look like. So here's an example of a tibial lengthening. Actually, in a similar type individual, smaller patient from California that had the procedure done. And this patient is about 1/2 inch or so of lengthening that's been completed thus far. You can kind of see the bone growth from there. One issue with her X-rays will be that if we use a similar type nail, the nail will go almost all the way down to the bottom of her bone. It may just fit into the bone to be able to do the lengthening. So I think if she's looking for a bigger goal, and that's more important than looking at the different ratios between the femur and the tibia, femur lengthening might be a more achievable goal to capture the full 8 centimeters of lengthening. To contrast that, femur lengthening kind of looks like this. So here's a patient that we saw earlier today that's having femur lengthening right now. This is kind of what their X-rays look like. The bone itself is a physically longer and bigger bone, so you're able to fit a bigger implant in there. Not usually a problem for most patients, but because of the size of her actual bones, it will be difficult, I think, for the tibia to place a long enough nail to be able to capture 3 inches. In addition, as I explained to her, it's all about percentage gain. 3 inches in her tibia is a significant percentage gain. The gastrocsoleus, which is kind of literally the Achilles heel of tibial lengthening, makes it challenging. You can only go so far until your soft tissues allow you to get to a certain point. Once you start getting some tightness in those soft tissues, we won't allow you to go any further. And I think for her, that probably will be closer to the 2-inch mark, about 5 centimeters. I think in the femur surgery, it still will be a challenge, don't get me wrong. I think it will still be hard, but I do think it's, in a pre-surgical setting, I think there's more of a chance for her to get to that 3-inch goal based on femoral lengthening than on tibial lengthening. So it may be something we have to revisit, maybe starting here and then maybe going to tibial lengthening down the road for a cumulative gain of potentially, maybe 4 to 5 inches potentially, which will get her further down the pathway. I've also explained to her that this is a very slow process, so lengthening happens in a millimeter a day or less, and so you can kind of watch yourself as you're kind of doing it and making sure that you're happy with how things look, standing, looking in the mirror, reflecting on it, and seeing how the image is looking overall as you kind of go through the process. Good.